Hi everyone, I'm Gerry Taylor. I'm the Director of Public Health for Sunderland. I just wanted to take the opportunity to give everybody an update on the position in relation to COVID-19 in the city.
What is the latest data telling us about COVID in Sunderland?
Well, the latest data shows that thanks to all of the hard work that everybody's been doing over recent weeks, that the number of cases did fall, but now they've stabilised, so they haven't increased or decreased recently. But what we have seen is that the number of people at South Tyneside and Sunderland hospitals is now increasing, and they're caring for the same number of patients as they were at the height of the pandemic in April, with over 200 people currently in hospital with confirmed COVID-19. So although everyone's been really working hard in Sunderland to reduce transmission, and I'd really like to thank you for that, it really is important that we all continue to follow all of the guidance to make sure that we slow the spread of coronavirus in the city.
Can you tell us more about the vaccination programme?
The vaccination becoming available is really good news, and I would really welcome it in the fight against COVID-19. It's going to take some time for the vaccination to roll out, with those people who are most at risk being offered the vaccine first. So those people who are most at risk will be contacted by the NHS when it's their time for their vaccine. If you're over 80, you will be contacted very soon and being offered your vaccine. Now, I'd really urge everyone who's offered the vaccine to take that offer up as soon as you can. If you want to find out a bit more about the vaccine programme, please have a look on the NHS website where you'll be able to see more information.
Are there plans to offer tests to people in Sunderland who don't have COVID symptoms like in other areas?
Yes, we've just started a trial of offering tests to people who don't have symptoms within the city. We started that this week, and once we announced the availability of tests, they were booked up fairly quickly. This is important as many as 1 in 3 people who have COVID don't have symptoms and may be spreading it without realising. So finding more people with COVID will really help us to reduce the spread. So if you have booked your test, thank you for doing that. It's really important to remember, however, that if your test is negative, you could still go on to develop COVID. So it's really important that you continue to follow the rules around social distancing, hands, space, face, and that you continue to protect others, remembering we're in tier 3, so we really need to follow those guidance to reduce the spread. So just to reinforce, if you have a negative test, you must continue to follow all of the guidance. I'd just like to end by thanking everybody for all that you've been doing over this year, and I really wish everyone a safe festive period.